Welcome to the Healthcare Technology Report, a leading information source on healthcare technology companies and solutions. In this episode, we speak with Casey Hite, CEO of Aeroflow Health, a personalized health partner that helps patients access medical equipment and supplies covered by insurance. Aeroflow Health guides patients through product selection, verifies coverage, submits required paperwork, and delivers curated supplies to the patient's door. The company also partners with health plans and healthcare providers to support member satisfaction and patient care, combining technology with communication, education, and services designed to keep patients informed throughout the process. Casey co-launched Aeroflow Healthcare in 2002 with his brother Don, and has overseen the creation and growth of business lines including Aeroflow Mom and Baby, Motif Medical, Aeroflow Sleep, Aeroflow Urology, and Aeroflow Diabetes. I am your host, RJ Lumba. We hope you enjoy the show. If you liked the episode, click to follow. Casey, thank you so much for taking the time to chat with us today. It's a delight to be with you.
Thank you. Nice meeting you.
It's a treat because I don't always get a chance to speak with the founder CEO who has built the company over the long run and is still continuing to build. You know, we frequently encounter those that maybe have shorter stints at a company, or maybe they brought in a ton of capital, they're looking to exit. So this is a real treat because I'd like to talk about the story. You know, to start, how did you, and I believe it was with your brother, how did you come up with the idea for the company, and what gave you the confidence to start a company at a young age?
So, yeah, I'd like to say that we had some sort of vision, right? And some sort of transformative thought on how we were going to revolutionize healthcare, right? But the reality was, we were two brothers. Both of us were either in between jobs or didn't care for the jobs we had, and we were looking for a way to make a living. I think what's unique about our story is that neither of us had any background in healthcare, actually barely any background in technology, but we decided to take a stab at what back then Aeroflow was just, we were started as a durable medical equipment company. We jumped in, both feet and started trying to figure it out. And, looking back, I would say that I hated the fact that neither of us had experience. But now, today, I'm like, it's a good thing we didn't, because it really allowed us to think dynamically and approach healthcare from a different perspective. I had a background in manufacturing, so I understood efficient manufacturing processes. And we got into healthcare, I was shocked by the inefficiency, the fragmentation of various processes, and everything was manual processes throughout. Mm-hmm. So that's kind of how we started. I can go into how we evolved. You tell me where to go next.
Yeah. Was there one product that kicked off the company, or even one connection or one angle where you said, this is where we'll start?
We start off as a home oxygen provider, which essentially delivering oxygen tanks to patients' homes. We've since exited that business, primarily because we couldn't find ways to leverage our strengths in technology and efficiency and in process automation in that specific business. But that's where we started.
How long did you do that business before you decided to embark into other areas?
I'd say 5 or 10 years.
Wow. Quite a bit of time.
Yeah.
And then let's fast forward for the benefit of our audience. What are the areas you operate in today?
Yeah. So I'd classify Aeroflow as a consumer-driven healthcare company. Uh-huh. We focus on products and services that people need and want, and really the specific products and services. We're the largest provider of breastfeeding supplies and equipment and education in the United States. Roughly 50% of mothers in the United States interact with Aeroflow at some point during their pregnancy. We're also the largest provider of incontinence supplies through insurance in the United States. That's providing things like diapers to disabled folks, largely folks that are on state Medicaid programs.
Mm-hmm. And then you have the diabetes solutions and sleep solutions as well.
Yeah, so really Aeroflow is made up of 4 divisions. It's Aeroflow Mom and Baby, Aeroflow Urology, Aeroflow Sleep, focusing on the diagnosis and treatment of sleep apnea and other sleep disorders, Aeroflow Diabetes. Mm-hmm. We also have a sister company called Care Compass, which helps people navigate their benefits, care coordination.
Mm-hmm. It seems as though the strength of the business, what really drives it, is your ability to connect with the end consumer and educate them and let them know what's available to them, because otherwise a lot of these services, they would have no clue that they are able to tap into these resources or how to even go about learning about them.
Yeah, you're absolutely right. So we've gotten very good at patient engagement, meeting people where they're at, educating them about the benefits that they have through their insurance. So that's the customer facing part, but where the real magic happens is on the back end and how we're able to tie all these disjointed systems together in a seamless way and still provide a great and timely experience for that end user, that customer.
hmm And is it the case that you've been able to identify some of the best kind of manufacturers of this equipment and then work with those manufacturers, but from the other end, from the consumer end, their experience is seamless? It's all Aeroflow.
Correct. Yeah, it's very important to look at it that way. If you think about healthcare in general, when's the last time you visited your physician online, completed everything, all the paperwork online, et cetera, and didn't need to pick up the phone or didn't need to get in your car to go see the doctor or didn't need to chase down some sort of paperwork, based off of a referral that physician sent you somewhere else. Unfortunately, there's a lot of misaligned incentives within our country's healthcare system.
hmm
Everybody focuses myopically in their specific area. There's very few organizations that try to tie those pieces together so that it all works.
Right. Could you give us a sense for the scale of the business currently? And you can use whatever metrics you're comfortable talking about.
Sure, we're a little over 1,100 employees, and, in the range of 650 to 750 million in annual sales.
And is it primarily the first two kind of solutions business areas you mentioned? It's breast pumps and continence solutions, or what's the biggest piece to the overall pie?
Sure, Aeroflow Mom and Baby represents a little over 45 to 50% of our revenues. Aeroflow Urology is about 25%, and the other two make up the rest.
hmm And have you found that, I guess, ever since you pivoted away from the original oxygen delivery, that your growth has been, fairly consistent year after year?
Yeah, knock on wood, we've gotten lucky. There's been a little skill. I'm not going to take any credit for it, but I'm surrounded by a great team. But yeah, our growth has been very consistent year to year.
hmm For the, listener out there, right? Like to start a business, and I believe you were just a couple of years out of school, and to grow it to what it's become today. I mean, that's a challenging thing to do. If you had to say like why you've been successful, what would that be? What would you attribute your success to?
Tenacity and grit and hard work. Again, I could give you a fancy answer, but the reality is the early days of the organization, it was about paying the bills. There were multiple Fridays, every other Friday. It was payroll time and me sitting in front of a computer, refreshing the bank account, just crossing my fingers, hoping that we got another deposit so we can make payroll. Honestly, we spent years in that position. I'll never forget what that feels like, right? And that is in my head every single day that I come to work. That feeling and that position we were in those early years is what really motivated us to innovate. We had to find ways to grow at scale and do it in a way that our expenses did not grow at the same pace.
hmm
And that's largely where technology and the focus on technology came from.
hmm
So, like a quick story around that. So, I'm classically trained as a salesperson, right? And so, early days of the organization, I was out calling on physician offices and asking them to please send us their next patient. But what we found was the more we sold, the less money we had. So one day I walked in my office and like, all right, we have to pay our bills. I'm not going to be poor. And I logged into the application that we were using at the time to run the business. And I sat there, I think, for the next 10 years, chasing and going down rabbit holes and trying to connect all these disjointed data elements together to try to figure out there has to be a better way. Where's all the money at? And that's when I figured out that, my gosh, as I stated, it's highly fragmented. The process of processing insurance claims, collecting medical documentation, tracking your accounts receivable, applying payments back to that accounts receivable, especially when you're dealing with, at the time, was only about 100 different health insurance providers. Now on our scale, it's thousands. But everybody has a different system. Every state Medicaid program has a different system and a different set of rules, right? And again, just like the rest of our healthcare system, it's very focused in their one area around their own set of rules. So being able to work with lots of different payers with several different levels of complex rules is kind of where our secret sauce came from.
Hmm. Did you find that you were able to naturally recruit, like you had this inherent skill of being able to identify and recruit the right talent for the right positions?
You're saying I did? Because I'm not sure I did.
I'm curious because, I mean, in order to grow a company, you have to have some skill at that.
You know what? A lot of trial and error at first. And I think what I realized after several years of struggling in business was our issue wasn't the quality of the people that we were recruiting and hiring. It was how we were leading and managing,
Hmm.
right? You know, your first inclination when you first become a leader is you've got to control everything. You know, I even reached a point, where I started to lose faith in people because I was micromanaging so many tasks that I got to the point of like, gosh, nobody can think. I better start writing computer applications so that the computer's thinking for them. Well, needless to say, that basically destroyed the business.
Hmm.
And unfortunately, my brother passed away in 2014.
Oh, wow.
And it was an awakening for the organization. It was an awakening for me because I could no longer micromanage every aspect of the business. And I remember looking at the team and saying, I can't do it. Like emotionally, I can't do it. I've got to step away. I'm putting my faith in your hands. And I came back about a month later and I was looking around going, wow, things are really operating well. And so since then, I have really leaned in to just 100% trust in our employees, put my full faith behind them, and inspiring folks, focusing on what they're doing right, not what they're doing wrong. And that's really kind of was a real turning point for the organization, for me as a leader. And it's what I attribute our success to today.
Hmm. So it sounds like you give people the time to make mistakes, essentially learn the role on their own and eventually get there.
So, that story is more in reference to our leadership team at the time, which, by the way, they're all still here. So, I won't take credit for recruiting the right people, but I will take credit for supporting folks that stick it out with the company. And I will have their back till the end of time. They know that. So, a big part of our success is also just the lack of turnover in our executive team. We have several individuals here that, have been with us for well over 10, 15 years. And they, like me, were new to healthcare. So we hired from outside of healthcare. And so they've learned through this process along with me. And so now what we have is just a very deep knowledge of not theoretical knowledge, but hands-on skill learned from trial and error and taking our hard knocks.
Hmm. Are folks all in person? Are you a hybrid kind of setup?
We're hybrid. We're probably roughly 80% virtual, 20% on-site. And then, of course, we bring folks to our corporate offices. Well, depending on the department, like for instance, our engineering and our development team, they come on site about once a quarter. Other roles are once or twice a year.
Looking ahead, do you envision that each of your four major categories will continue to grow sequentially? Do you think of expanding into other areas as well?
Well, of course, yeah. Right now, when we look at our four major divisions, and of course, I think I spoke to you about Care Compass, that's a new business for us where we're helping people coordinate their insurance benefits virtually and, of course, in person through the use of social workers. So we see a lot of room to expand in our existing segments. As an example, our mom and baby division started off selling breast pumps, right? And then from that, we went into compression garments and things like that, and other accessories that moms need while they're pregnant. But then we branched off into education, lactation support. So right now we have roughly 20,000 unique visitors a month to an Aeroflow lactation class,
Hmm.
where we have lactation consultants that are teaching classes and teaching moms in preparation for having a baby on how to breastfeed. And then, of course, we're doing individual appointments with patients that are struggling to breastfeed after they've had their baby. And so what we're doing with our education segment is we're expanding that into urology, where we're helping, things like pelvic floor health in urology. In our diabetes division, we have expanded into nutrition counseling,
Mhm.
using dietitians to teach classes as well as perform individual visits. And that's what led us to Care Compass, is kind of connecting all of these things together and helping folks find different products and services that they need that are typically covered through insurance or offered through different state Medicaid programs. to help them reach those benefits that they need. And this is primarily folks that are either disabled or from lower socioeconomic backgrounds, and helping them navigate their insurance benefits.
Mm-hmm. We're coming up on time. I do have two final questions. One is, can you tell us about a person who has had a profound influence on you?
It's hard to identify just one person. I'd say more than anything, it was the first CFO we hired. He was one of the people that helped teach me to let go, stop micromanaging so much, and put my faith in people. Actually, him as well as my father-in-law, they both were telling me the same thing. I remember my father-in-law gave me a short piece of advice when my brother passed away. And he said, look to your team, ask them for help, and put your faith in them.
Mm-hmm.
And so I guess one individual would be my father-in-law.
Mm-hmm. Excellent. Last question. Can you tell us about a charity, cause, or other endeavor that you're passionate about?
Sure. We're involved in multiple charities. For me personally, the plight of single mothers.
Mm-hmm.
There are so many moms out there that have children and are raising those children by themselves with little to no economic support. That's a passion of mine, and that's where we try to contribute. For me personally, I try to contribute to any cause related to the plight of single mothers. And then again, as an organization, we try to support various other things that are related to the businesses we're in.
Wonderful. Well, Casey, I want to thank you again for taking the time. It's been a great conversation.
Thank you so much. Nice meeting you.